In a home visiting program, the infant and early childhood mental health consultant is supporting providers going into homes and community settings who are encountering families who have challenges with behavior, mental health, and/or attachment. The infant and early childhood mental health consultant is supporting the relationship of the caregiver and the child, as well as the provider to the family. Hi, my name is Marnie Stone, and I am the Program Administrator for the Child and Family Network. On a day-to-day basis, an infant and early childhood mental health consultant within a home visiting program is going into homes and community settings to observe, listen, ask questions, and provide feedback. We lean into the strengths of the provider and family and suggest new ways of interacting between parent and child or provider and family. Home visiting teams will also invite an infant and early childhood mental health consultant to their staff meetings to do much of the same: observe, listen, ask questions, and provide feedback. A consultant might be listening for families with complex needs, themes of challenging topics for the providers, psychoeducation opportunities, and times for reflection. As infant and early childhood mental health consultants, we are partnering with home visiting program staff and supervisors, local community early childhood coalitions and groups to stay attuned to community needs and resources, and healthcare providers that are supporting the family and child. It is overall about building the capacity of the home visiting program staff and supervisors to serve the families in their programs. Home visiting providers reach out for infant and early childhood mental health consultation when they observe a family with complex needs, children with challenging behaviors, or are feeling overwhelmed or frustrated. One-on-one consultation allows for the consultant and home visiting provider to reflect on the home visitor's experience with the family, their personal experiences that may be impacting their work, the mental or developmental needs of the child or family, and reflect on strategies to address those topics. One-on-one support allows for a provider to build overall capacity by discussing needs around several different cases. Joint visits with a family could happen when the home visitor and infant and early childhood mental health consultant partner on a case with the ultimate goal of the provider building confidence and awareness to address family needs in the future. The consultant goes in as an observer, watching what typically happens during a regular visit. We're watching for places and times where the home visitor and family get stuck or have challenges. Then we ask questions and use modeling to suggest new strategies. After the visit, the consultant supports the provider by partnering to incorporate new skills into their visits. Joint visits are really focused on observing, listening, and modeling to support the primary provider and family feel safe, educated, and prepared. Within a home visiting program, an infant and early childhood mental health consultant can support ongoing assessment through administering or training on screening tools and/or having discussions with providers on the progress made from baseline data. We are increasing the competency and quality of services being provided to families by supporting the provider's education, confidence, mental state, and awareness. In regard to resources, the infant and early childhood mental health consultants are often connecting caregivers or providers to mental health resources, basic needs supports, articles or research, and continuing education opportunities. The most common needs that infant and early childhood mental health consultants address in home visiting are behavior support, personal experience, and cases involved with Child Protective Services. In regard to behavior support, consultants address challenging behaviors and work with the provider and family on safety and social emotional development and regulation. Regarding personal experience, the consultant helps the provider reflect on their experiences with the family, as well as supports the provider to identify the caregiver's attachment styles, thus working to foster deeper impact and connection between provider and family. And finally, in cases involved with Child Protective Services, providers often receive referrals and need support knowing how to meet the complex needs of the family. In any setting where an infant and early childhood mental health consultant is placed, training can be provided as a means of support. Trainings might include screening tools, relational health, social, emotional development, infant mental health, topics related to overall early childhood development, or trainings that enhance the quality of services provided, as well as meet professional development needs. With home visiting programs, infant and early childhood mental health consultation is trying to support nurturing and safe environments for children to grow up in. We know if children have secure attachment with their caregivers, then they will exhibit trust with not only their caregivers, but with other adults in their world, learn problem-solving skills, have friends and get along better with their siblings, have higher self-esteem, and be kind to others. The impact is healthy and secure attachments for caregivers and children, as well as the increased capacity of providers to feel equipped to support the mental and behavioral health needs of their families.